Bismillah ar-Rahman ar-Rahim. Assalamu alaikum wa rahmatullahi wa barakatuh. Dear brothers and sisters, welcome to another show that we don't have a name for it. And tonight we're having Dr. Sharjeel with us, Dr. Sharjeel Kiani, who's been an NHS doctor for 8 years. He's a registrar and he's been working on the front line now, in the front line. So he's been experiencing witnessing the coronavirus and the way the COVID-19 virus and the way he's been dealt with by the NHS, and also have seen how the people are suffering and struggling with it to do with different reasons. Without further ado, we'll bring in the brother Dr. Kiani, and we have also with us today brother Sohail as well, the usual suspect. Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum salam.
Wa wa barakatuh.
How are you doing, Doc?
Alhamdulillah, it's a pleasure to have me on the show tonight.
Jazakallah khair. It's likewise, actually. It's a pleasure to have you as well. Thank you. It's a pleasure to have you here as well. So, Doctor, how are you?
Alhamdulillah, given the situation, alhamdulillah, I'm doing well.
Alhamdulillah. So, you've been working for the NHS for 8 years now?
That's right. So, I graduated in 2012.
Mm-hmm.
I studied Hull and York Medical School. Before that, I was born and bred in Newcastle. And then I studied medicine at Hull and York Medical School. Studied in various parts of Yorkshire, including Scunthorpe, York, Hull, Scarborough, Grimsby. Returned to Newcastle 2012. Worked for 4 years in the hospitals in the northeast, including quite a few different hospitals in the northeast actually. So the RVI, the Freeman, Durham, Darlington,
MashaAllah,
Cramlington. So, did months here and there, years here and there in the first 4 years.
Mm-hmm.
After that, I moved to Birmingham and have worked in this region for also a few years, since 2016. So I worked in Stoke, in Walsall, and currently I'm at City Hospital, which is one of the main hospitals in Birmingham.
MashaAllah, tabarakallah. But at the minute, where are you based? You're in Birmingham?
Yeah, currently in Birmingham, in City Hospital, working in the acute medicine department.
Mm-hmm.
So acute medicine is what I've been working in for the past few years, and inshallah ta'ala, I'll be a consultant in acute medicine in 3 years' time.
MashaAllah, tabarakallah, inshallah. So, we usually ask our guests about their families and how they are. But to be honest, in your case, we're going to go back to this, but we're really keen to go straight into the topic. You are every day working with coronavirus patients.
That's correct. We're seeing...
Yes, go on.
We're seeing generally most of the admissions to hospital now are patients who would be at least suspected coronavirus patients, because the problem is the testing, because you will not know that a person is confirmed positive until after 48 to 72 hours.
Okay, so that's one of the issues. Yes.
Yeah. You have to treat anyone coming in with shortness of breath, difficulty breathing, fever. You have to treat those patients as if they may have coronavirus infection.
So that puts the pressure then on the NHS, because it seems they're taking a lot of people in, but they might not be actually.
Correct. A person could come into hospital. They may or may not be someone who has a coronavirus infection. And the difficulty is that if someone comes in with breathing difficulty and fever, even if they haven't got coronavirus, because they're going to be around patients in the hospital with coronavirus, they may end up catching coronavirus infection from other patients.
Yeah.
That is why generally the advice from 111 is that people who have mild symptoms should try and keep themselves at home.
Mm-hmm. Okay.
Because now more than ever, there's actually a personal risk for an individual coming to hospital unnecessarily.
Oh, subhanallah. Subhanallah. Sohail.
Assalamu alaikum. Assalamu alaikum.
Alaikum assalam.
Brother Dr. Sharjeel, mashallah, tabarakallah. It's beautiful to have you on the show. I've known our brother here, the doc, as we like to call him affectionately, for quite a good few years, mashallah. And I mean, I know I've been in touch with you over the weeks that have come, because obviously for my own sake, my own family, when my daughters were a little bit ill and their friends were ill in school, and getting your advice, I think it's important to get that. But yeah, let's go back to yourself and your family. It's like, how is your family coping? And I know you've got your parents in Newcastle and your family's in Newcastle as well. How's your family in general? How are they all coping with it all?
Well, first of all, most of the time, as the month of Ramadan approaches, I bring myself back to Newcastle.
Right.
I tend to be in touch with you brothers, but it looks like this year that's not going to happen. So, as in I'm not going to be able to get to Newcastle this year, so that's sad in itself. That was the routine that I was in for the past few years, taking some annual leave during Ramadan, coming, spending time with family, spending time with the brothers, and we're not going to be able to do that this year.
Yeah.
So, regards to family, we live at home with my wife. We have a 2-year-old, and we have now also a boy who's going to be 2 months old.
MashaAllah.
That in itself is a difficult period when you have a baby that doesn't sleep. So you don't sleep much, because the baby doesn't sleep, you don't sleep much, and then you go to work, and then generally it's a getaway, isn't it? I think fathers will know. It's a getaway to go to work with family. So, tongue-in-cheek comment, I still think it's easy going to work than being in the house. I'm sure that a lot of people may agree with that.
Alhamdulillah. So, bro, I mean, let's just go back a little bit further as well. In terms of, tell us a little bit about this coronavirus, man, because I think there's a lot of misconceptions, even still, a lot of misconceptions about what this thing actually is. Because you still hear people saying, well, it is just the flu. And then I know what you mentioned about things like people have mild symptoms. And I think there's a balance, right? A lot of people are going on one side going, oh, it's just the flu. You only get mild symptoms, it's all right. But then there's the other side where it's a lot of scare tactics of like, it's causing mass death. And I don't know where we stand with it all. It's like, I know someone like yourself who's on the front line. Tell us a little bit about what the virus is all about, and also what your thoughts are on it all. And I know you're not a specialist, and we have to put that out there, that you're not a specialist in the coronavirus itself, but I'm sure you can hopefully give us a little bit of an insight, inshallah.
Right. So there are very few specialists in coronavirus, because this is something, COVID-19 is the coronavirus disease 2019. It's only been around for a few months. And generally, when we get to know about an illness or a disease, it takes years to get to know about it. And even in England, we've only had exposure to this virus for several weeks. So there's not been enough time to have any research trials into the disease, into the treatment. One of the reasons why there is no established treatment yet in England. This coronavirus disease emerged in China, in Wuhan, in Hubei province, towards, I think it was December or late November. And certainly that's when they informed the World Health Organization about the problem. And since then, probably because of the way we have air travel these days and mass movement of people across the world, generally every country seems to be affected by this now. It's from a family called coronavirus. But this actual strain of the virus is new. That's why it's called novel. So, it's quite amusing actually that someone posted on Facebook once a pack of some Dettol wipes or something like that, and it said coronavirus on it. And this is one of these strange conspiracy theories, like, this virus has been around for ages.
Yeah.
No, yes. That's family, And this is the most frustrating part for me, and I'm sure frustrating for you, is too many people seem to talk too much about things they know little about.
Absolutely.
And me, myself, I'm very careful not to talk about something I don't know about. And even in the field of medicine, I've studied for 5 years. I've worked for another 8 years. That's 13 years of my life, studying parts of medicine. And I can easily say that I don't know much about coronavirus. We do know how it presents, how people come in, and who we should be testing, and how we should be managing them. But there's no established treatment in the virus, and there's still a lot of unknowns about the virus.
So I mean, so we know, because there's this thing called the coronavirus we know about, right? It's just that this strain.
You mentioned about the flu.
Yeah.
Now, initially, I think, like many others, I was probably one of those, a few months ago, who was hoping that it would be like the flu. And there was certainly a school of people, a school of even scientists, medics, that hoped that, it would be a similar concept to the flu. But as time has passed, I'm sure even lay people have now come to accept that this is not really like the flu in the sense that this is a lot more infectious and a lot more serious than the flu. It's causing a lot more mortality, a lot more deaths than the flu. Yes, some individuals who are positive for the coronavirus may have symptoms which are very similar to the flu, but disease process is slightly different, and the complications are different, and the infectiousness of this disease is also very different. It's very infectious, and that is probably the problem we're having, that this disease is very infectious. So, for example, you guys will have heard about Ebola. Ebola was a lot more dangerous than coronavirus, COVID-19, but it was less infectious.
Right. Okay, so this is why we've got things like the social distancing, the self-isolation, the washing of the hands a lot more, and those kind of things in place. I take it that's why it's happening. Bro, it's really scary times, I think, as I mentioned before, and I think a lot of this from is because we know who's at risk and who's more at risk, especially our elder generations,
yes,
our parents, etc. And that's, I think, a lot of the time is why people are being a lot more cautious.
I think this is a terrifying thing, that when this is all said and done, we're going to personally know individuals who've lost.
Yeah, I think that's the crux of it all. Yeah.
God forbid, for a lot of us, it's going to be relatives and household members. If it's not people that if all of us will know someone, I think, affected by this personally, know of them personally, and most of us will perhaps lose relatives from this.
So are we talking? So are we talking about all generation, or is it not just the elderly, the weak immune system, or everybody?
Again, initially, we were hoping, that the younger people will be spared. Not that we just care about ourselves,
Understand,
but this week, again, the full facts and details need to come out. But it's been reported that a 13-year-old died of this infection. Yes, it's an exceptional case, but it's still distressing to hear.
Well, you're absolutely right.
Scary, that.
It is.
Every week, I remember, I think it was almost 10 days ago, where the youngest person to die was 21, and then we've seen this age come down. I think, the very first we probably got to the way the media have been reporting deaths would be 54-year-old known health problems, 40-year-old known health problems. But now we've seen this term known health problems come away, and we're seeing people fit and well, critically ill, and people fit and well who have died from this illness.
Richard, anything that you wanted to comment on?
Yes, bro. So how do you cope with your family? Obviously, being the front line, you go back home and you actually bring danger with you home.
Well, this is bringing out the OCD in all of us. And rightfully so, to be honest. Normally on a normal day, pre-coronavirus era, I would go to work in my normal clothes, my shirt, my trousers. I would go to work in them clothes, come home, have a shower. And now I think most of us are having to wear the hospital scrubs, which I think you've seen. You know what I mean by the hospital scrubs, the blue pants and the t-shirt.
Yes.
So those of us who are exposed to the virus, working in the emergency areas of the hospital, are all wearing scrubs. So we go into work, we change into the scrubs. When we're in contact with patients, we wear PPE. You might have heard this term, PPE, personal protective equipment.
Okay.
And when we go home, we change back into our normal clothes. Either you have a shower at work, or I have a shower first thing when I come at work. I take off my shoes in the porch. I try to leave as much equipment, as much things outside of the house.
Yes.
Roll up my trousers, try not to touch anything, run in, take my clothes up, put them into the laundry, and have perhaps the longest shower I have these days is, shampooing my hair and beard every day now. So
you're scrubbing basically about twice a day. Every time you go to the hospital, it's twice a day. And And your shift, how is your shift? Is it every day? How long?
So most people who are junior doctors, junior doctors is a bit misleading, because you can have worked for 10, 12 years and you're still a junior doctor until you're a consultant junior doctor. So most junior doctors will be working about 25% of the time on average, on-call shifts, and most on-call shifts are 12.5-hour shifts.
Allahu Akbar.
And sometimes you will do 12.5-hour shifts up to 4 shifts in a row.
Subhanallah, subhanallah. How did your wife took the news about you being frontline, and how she's coping with it?
But I think this is something, the anxiety is growing amongst all of us in the public and in the medical profession, because as you see the death toll increase, as you see reports of there being younger people dying, it becomes more difficult to deal with.
Yes.
Because the reality is, although it's still exceptionally rare for a young person to die from this, a 30-year-old or 40-year-old, the reality is when you hear of a 30-year-old dying, you're going to think, I'm the next person who's going to die.
Yeah.
Your anxiety is going to tell you, okay, I could be the next one. When many relatives of doctors will also fear for their family, because when they hear that 35-year-old, when they hear a doctor died or they hear a nurse died, they will think, oh, my son or my daughter or my father was also a nurse or doctor, they could be the next one.
Yes.
So I'll be honest, a lot of the Muslim doctors now are actually making their wills.
Subhanallah, Allahu Akbar.
And there's been feedback from companies, I guess we call them law firms, that do Islamic wills, because the will is something very important for a Muslim. Even before this coronavirus era, we were advised to make wills, were we not?
Yeah.
Unfortunately, most of us probably didn't do that, because the innate nature of a human being is that we think we're going to live till 75 and go into old age. But
do it for full 9 yards.
Yeah, and as we know that the coronavirus can affect a healthy individual, a lot of Muslim doctors have been making their wills. And I'm sure it may be the case for non-Muslims, but I can only report on what I know amongst my own circles, which is the case that people are making their wills.
Subhanallah.
Doc, I mean, we've had a question that's come in, and brothers and sisters, if anyone has any questions, please don't be shy in asking the questions. We've got Dr. Sharjeel on the show today. He can answer any of the questions that you have medically, hopefully, inshallah, or some advice with regards to what's going on today in our times of distress, I guess, with the virus. There's a question that's come in, Doc, that says that you're a father. Don't you fear going home to your children after being around coronavirus?
Yeah, I mean, I think the most reassuring thing is children seem to do very well with the coronavirus.
Okay, alhamdulillah.
I can't really act on probabilities of less than 0.5% or less than 0.1%. It's not really how we live our lives. So there's, as Muslims, although we believe in the qadr of Allah subhanahu wa ta'ala, we do also inform our decision making with statistics, do we not?
Yeah.
So the reality is I still have a greater chance of dying in a car accident than dying with coronavirus. That may change, but and certainly with the chances of my child dying of coronavirus are very slim compared to me putting my child in the car and driving. I never stopped driving because of the risk of being in a road traffic accident. So
may Allah protect them all.
However, I wouldn't want to. I wouldn't want to even give a cold-like symptoms to my children. As some of you know, children get fever, children get sick, children have coughs.
Yes.
Need to go to hospital. That in itself is distressing. Do I feel about that? Yes, I do. So it is distressing, and I think every doctor feels uncomfortable about the fact that they may bring the virus home to them. It's more distressing that I could give the infection to my wife and other of those children. That's more distressing, actually.
Yes. We have plenty of questions today. Go on, Sohail, but we have plenty of questions today, so be prepared, Doc.
Good. Another question that came in was, do you see doctors and nurses crack and break down because of the infections and death?
Testimony to the great healthcare workers in the NHS. I think, let's be real here now, is that I'm a 30-year-old. What about the 60-year-olds? What about the 70-year-olds? What about the people who've got health conditions and they're still going to work.
Yeah.
It's a whole different kettle of fish.
Mm.
You know, if you know, I think if you're 60 years old and you're going to work and you've got a health condition, you're thinking about your death a lot. My hat goes off to these people, really. You know, these are my senior colleagues. These are nurses, you know, who've got health conditions, who are in the higher risk categories because of their age. You know, the retirement age, what is it in this country? Is it 70 something? That means people up to that age continue to work. So I have the utmost respect and courage of those people. Generally, are people cracking? No. Is there anxiety and fear? Yes, there is anxiety and fear, unfortunately, yeah.
We have a question here from Abbas. Go on, sorry.
I think a challenge for healthcare workers is how we deal with that anxiety, because it's a unique problem that every single person is suffering with this. So it's a very unique problem. You know, everyone goes through adversity, but now in the West, we're going through adversity together. You know, it's a very unique problem. Normally we have personal issues, and so our personal issues, no one else knows about the personal issue. You're just going through it yourself, but everyone's going through it. Some are affected more greatly by others, but every single person is affected with that. Yeah. So the challenge is how we work together and how we channel our fear and channel our anxiety. What you don't want in workplaces, and it applies to all key workers, not just NHS workers, is when you're having to work and you have this fears, how do you manage that fear whilst, you know, still manage to work as a team?
Yeah. So we have a question from Abbas. Jazakallah khair for this, Doctor. But we have a question from Abbas. He's asking, what are the most common ways of contracting the disease, and do you think it could become airborne?
Well, the common way of this disease spreading is through droplets. And the most common way that is coughing and sneezing. But we also know via contact you can also contract this disease. And that is why, you know, I'll relate it back to the Muslims, that's why a lot of the ulama alhamdulillah, very early on said, we don't need to shake hands anymore. You know, the threat of this virus is real. We don't need to shake hands anymore.
Yeah.
You know, and that is why you have social distancing, because you don't need to be in that physical space of individuals. So contact is also a way. And there's also enteric, which is more rare, but it's possible. You know, enteric, normally, you guys have heard of food poisoning. You know, when someone basically, through their feces, there's contact with the skin, with the hand, they're not washing their hands properly, they prepare some food, another person, he eats the food, and there's been a spread that way. That is more rare, but again, because the question was asked how it can be spread, it's also a potential means of transmission. But by and large, the main three is coughing, sneezing, and just through skin-to-skin contact.
Well, thank you for saying that, because we have a question here from also Nakash Rashid. He's saying, is the only way of catching the virus through the mouth, nose, and eyes?
Yeah, so the ways of catching is through the mucous membranes.
Okay.
Yeah? So the mucous membrane includes everything you mentioned, which is the nose, the mouth, and the eyes, basically. So they would be the main three. Yeah. I mean, there's no evidence that, for example, it's sexually transmitted, you know, or via blood, so via needles. Again, I've not heard any evidence that there is bloodborne transmission or sexual transmission. It tends to be, you know, the respiratory mode of transmission.
Okay. So can it be airborne by any?
Can be airborne, and generally, you know, obviously, if you sneeze, you know, I don't want to go into like the definitions of what is airborne, but if by what he means by airborne is he means that there can be particles in the air for a period of time. It can be, but there is debate of, like, when you sneeze, there is some debate of how long the virus particles will remain in the air. You know, I've seen some videos from Japan where they're trying to video this, but there's no consensus amongst how long after a sneeze or after a cough, how long the virus particles remain airborne, and the significance of this. You know, it will be very academic level discussions.
Okay, thank you. So, at home, your child, how are you making sure that he's protected?
The main way I'm protecting my family is the way that everyone else is protecting their families, or at least the way they should be protecting their families, is by staying at home My wife hasn't left the house for a few days.
Yes.
And I have, instructed my loved ones, including my mother and father in Newcastle, my sister, my aunties, that you should only really be leaving the house if absolutely necessary for necessity, food and drink, really, and that's it. Even if you have a doctor's appointment to attend, you should be calling up the surgery and saying, in view of the risk now, is this something I should turn up for or not?
Okay.
For example, my baby had to get some vaccinations the other day, so we weren't sure, about that. So we called up and found out, and this particular GP surgery, they advised that yes, we're still giving vaccinations. So social distancing, staying at home, these are by and large the best ways to protect yourselves. That the main fear in the Muslim communities is that we live in households where we have several generations.
Yes.
Yeah.
We've got grandparents, fathers, our mothers, and
correct.
And I hope it's not best, but what was happening is people just think the fact that their grandparents are staying at home was keeping them safe. But no, actually, when the youth were going out, for perhaps unimportant reasons, they bring the virus back home. And there was this misunderstanding that people thought that, well, actually, right now I'm okay. I don't have a sniffy nose. I don't have a cough or a fever. That means I'm not infectious. I'm not infected at the moment. But no, there's a crux basically, because you catch the virus and then after a few days you get the symptoms.
Okay. Meanwhile, you're actually spreading it.
If I go to work now and I catch the virus, I'm not going to know till a few days' time anyway.
And meanwhile, you're spreading it.
Correct.
Okay. Well, okay.
A person can be asymptomatic. A person can have no symptoms and can spread this disease.
Allahu Akbar.
And that is that's the unique challenge in this disease.
It is, because we also have other frontline workers. So, for example, we've got the volunteers who are going out to deliver the food aid, the basic food aid from different organizations, such as the Crisis Aid and IDC and the Tawheed Mosque in One Nation, One Ummah. So what's your advice to them? Because they go back home and they have also family and elderly and probably people with weak immune system at home. What's your advice to them, please?
My main advice is to really think about how to reduce the risk of disease transmission. So, and frequent hand washing. I think frequent hand washing cannot be understated.
Okay.
Using soap, washing for 20 seconds, trying to make sure you're not missing parts of your hand during hand washing, because it's common that people would miss parts of their hand when they're washing their hands. People just do the movement and I think they wash their hands, but now is the time for real hand washing. So frequent hand washing. If you've got alcohol gel, it's good to use as much as you can. When you're giving this food to the elderly people, you should do it in a way which reduces the risk of transmission. I think people seem to have been using common sense. I have seen videos of charities doing this, and they do leave the food in bags at the doorstep. They will knock the door and come back. It seems quite sensible to do that. And obviously, you want to really only be doing that for the most vulnerable individuals. So really triaging and knowing that, yes, this is a vulnerable person who will come to harm if we do not act.
Okay. We also we've seen, we've heard, and we've witnessed some people who still go out maybe for a drive in the car, or actually go into the park or walk in the forest. What is your advice on that?
Well, initially the government said, you can go out for exercise, but the problem is when everyone goes to the park, then you're going to have as many people in the park now as there were, for example, in the shopping mall.
Yes.
So the whole point of this is that you reduce your exposure and you reduce exposure to you. So if you're going to become crowded in the park, then it defeats the purpose, really.
So are you saying if they want to go to the
barbecue?
Sorry?
Don't you know barbecue?
Yeah. If you're saying if you go to the park and then but you keep your social distance, is that okay?
To be honest, I would advocate that a person, especially if he has a garden or he can exercise at home, in my opinion, we're better to exercise at home.
Okay. So we've got also another question from Sister Jill Chihaibi. And she's saying, Assalamu alaikum, is the NHS using high dose vitamins to help the combat the coronavirus like China did?
Yeah, no, we're not. I think the research into the association with low levels of vitamin D and the severity of infection is not one that's been established yet.
Okay.
So there is no, for this virus in particular, there is no specific treatment.
Okay.
So when these patients come into hospital and they're deemed, this is what I would do, these decisions I would make is, does this person need to stay or can they go home?
Mm-hmm.
That decision is not based on whether I think they've got the infection or not.
Mm-hmm.
That decision is based on how sick or unwell they are, whether they need to be here or not. Because if I think they're positive, they can still go home, to their own house.
Okay.
And
self-isolate themselves.
Yeah, correct.
Mm-hmm.
You don't need to come to hospital.
Mm-hmm.
But if you have a person who is very breathless,
mm-hmm.
their breathing rate is high because of respiratory distress,
mm-hmm.
their oxygen levels are low, then those people need supportive treatment. And what do we mean by supportive treatment generally in hospitals? We mean giving oxygen. Sometimes we will give, a lot of the time we will give antibiotics because a bacterial infection can also coexist. And also it's very difficult until the results come back, even when the results come back, to rule out there being a bacterial infection. So we give antibiotics. We do things like measure blood pressure, and we refer the most sick patients to critical care in the event that they may need a ventilator, which I'm sure we've all heard the term ventilator in the past few weeks.
Yes. We have another question. As I said, we've got plenty of questions tonight. We've got another question from two, Misa Lin and Hassan Hamid. They're asking, is it worth it to put a face mask on? Does it decrease the potential?
Yeah, there's a lot of debate about the face mask. Official advice, and it's only correct for me to really give official advice, is that there was no evidence for people to wear face masks in public like we've seen in China. And a lot of the experts were saying actually it's not really going to make much of a difference, and really that the focus of infection control can be hand washing, basically.
Okay.
However, if an individual wants to wear a face mask, there's no harm in it. They just need to they must not neglect washing their hands, because if their hands are dirty
mm-hmm.
and they're touching their face
mm-hmm.
and touching their face, then that is the face mask. If you rub your eyes after you not clean your hands, and that may be a way that you contract the virus.
Okay. Okay. Thank you. Go on.
A lot of countries are changing their advice about the face mask, and people should just keep following the government's advice. Yeah. And another problem with the face mask is that these things seem to be running out.
Yes.
Fortunately, what we've seen is a lot of people who are wearing face masks is, where did you get a face mask from?
Mm.
What is the black market for face masks? Because even if I wanted to buy a face mask now, where would I get it from?
Subhanallah. Yes, we have struggled with the mask for the volunteers.
We can't be taking face masks away from nurses who are with the patients 12 and a half hours, because that's a dhulm, on those people.
You're right. You have a few compliments. One of them is from CQC Inspector. She's saying that thank you so much for myth busting and giving great advice. So that's one good for you. We have a question from Umayma bin Zamir. She's saying, is it worth it? Is it worth cleaning our groceries before we bring it into the house?
Well, for example, my groceries the other day, I asked my wife to, the aubergine. I asked my wife to wash the aubergine because that aubergine was exposed.
Yeah.
But generally, things in plastic packaging, I think it's safe enough just to open the packaging and the thing goes out.
Mm-hmm.
Thing comes out the packaging. I haven't yet resorted to washing packaging. I'm not sure how practical that would be as well, because that's how you store things in the house anyways. For example, if you got cereal bars, what are you going to do? You're going to take every single cereal bar out and put them somewhere else? Or it's not quite practical. And everything is there's obviously theoretical risk in things, but there's also your realistic risk of contracting infection.
MashaAllah. We have a very nice compliment from Umayma bin Zamir. She's saying, an excellent and informative show. Jazakumullah khair. Jazakumullah khairan. May Allah reward you, brothers, and protect us all. Alhamdulillah. Ameen. Jazakumullah khair, Sister Umayma. We've got a question from Shazia Omar. She's asking, I've had symptoms for almost 10 days. Sometimes I still feel lightheaded and not well. Does that mean I am getting better?
Well, first thing, unfortunately, you'd be hugely responsible of me to issue any sort of
Okay.
medical advice
Mhm.
on the show. I do pray that Allah subhanahu wa ta'ala grants the sister shifa.
Allahumma ameen.
Talking generally, not in this case of the sister.
Yeah.
Symptoms can go on for days, and sometimes worsen before they improve. I've seen patients that, on day 1, day 2, they're not so bad, and then day 5, they're worse, and then after they recover. And there's also been anecdotal reports of patients having symptoms, and then some days no symptoms, and then days of symptoms. The problem is that the human beings are all very diverse in terms of their bodies, basically, and the symptoms will manifest differently in different people. That's why sometimes you may notice in your households, actually, every time I catch a cold, it's a runny nose, and every time my wife catches a cold, it's always a sore throat. It's because people's individual bodies react differently.
Yeah.
If I was to give general advice to people, is when to seek medical help would be, if you really do find it difficult to speak full sentences, you're finding it difficult to breathe, you cannot breathe when you lightly exert yourself. So, for example, you're going to the bed, the toilet, you can't breathe, and you're going to collapse, you're having that much difficulty breathing, then you really need to be calling 111, who would then obviously consult the hospital and decide on whether to bring you in or not. Okay. Fever, normal things like use paracetamol. You're going to get muscle aches. You're going to get a lot of these symptoms. But I think an individual generally knows when they're seriously unwell, and that is the time to seek help. I wouldn't be too alarmed if mild symptoms are persisting for longer than expected. I wouldn't be too alarmed by that.
So the expectations, is it 10 days for the symptoms to be persistent?
Symptoms can last for longer than 10 days.
Allahu Akbar. And we also have the period of the few days before it actually start to show symptoms. So that
yes,
are we talking about 2-3 weeks here?
I think that's possible.
And meanwhile, so is it now proven that if somebody got it already, will not have it again?
I think that's difficult to prove because we haven't even got the testing for that yet in England. And there's been anecdotal reports of reinfection. I think the issue is not certain. We hope that obviously one infection would infer immunity. We would hope that would be the case.
Yeah.
There's not really been any kind of scientifically proven case in England of a person being reinfected.
Yeah.
Alhamdulillah, that's good news.
Alhamdulillah. Okay, we've got Lenny Hart. Salaam alaikum. She says, today the news said the doctors have to choose between who lives and dies. If overwhelmed by many cases, how can anyone cope with that when asked to make that decision?
First of all, I was corrected with this myself, so I'll be very clear with this, that it's Allah subhanahu wa ta'ala, from a Muslim perspective, I must speak, that chooses the one who lives and the one who dies. But we, of course, do all we can do in the process to save someone, because we know that in the Sharia you can save a life.
Yes.
Issue of trying to decide who you can help or who you cannot help with limited resources. And this is the heartbreaking thing. So when you hear of flattening the curve, it's basically, to give it hypothetical situations, you're going to get 1,000 cases in your one hospital, Adopt a policy where you're going to deal with those 1,000 cases over 7 days, or are you going to adopt for a policy which is you're going to deal with 1,000 cases over 4 weeks? So when they say flatten the curve, trying to buy time here, basically. So we want the total number of people over a longer period of time, so that each of them will get more of the resources available. Now, the limited resource in hospital is basically the ventilator or the life support machine, call it what you may. And generally, each hospital only has a handful of that, of these. We're talking numbers between 5 and 15, I've not heard of many hospitals having more than that. And the problem arises is when you get so many people and they all need ventilators. And putting someone on a ventilator, it's not that they're going to spend a few hours on the ventilator and they'll be fine. No, it's a long process. They may be on a ventilator. They may need to be on a ventilator for a few weeks. That's one ventilator gone for a few weeks.
Yeah.
Okay, and then you've got a few ventilators left. And generally, hospitals manage. But now we've got so many people who are so seriously ill, so deprived of oxygen in their bodies. To keep them alive, they need to go on a ventilator.
Yeah.
And the problem will be when those ventilators run out. And the tragedy will be people that would ordinarily, pre-coronavirus era, would have had a chance to go on the ventilator, will now not get the chance.
Yeah.
How do we do this as a medical profession? Choose who goes on a ventilator or not? Generally, we look at the outcomes. So, for example, we know that an 80-year-old person who struggles to even leave the bed, who has heart failure, needs dialysis for their kidneys, and they've had multiple strokes, and they're very weak. Generally, we know that putting that person on a ventilator is a very bad idea, because all we would do is subject them to just basically a very unpleasant experience, to put it lightly, with no reward at the end.
It's a tough call.
They don't make it.
It's
a very tough call.
Yes.
And it's going to be a dynamic process that each hospital will have to make those decisions. They consult the intensive care doctors, and they would decide how many ventilators they have available, and also what is the patient's likelihood to survive. But yeah, undoubtedly, we're going to be in situations where there will be some people who would have liked to put on a ventilator, where there's no physical ventilator available.
Subhanallah. I've been told by my team that Lenny Hart is a man, so I'm sorry, brother. I've dressed like a woman, as a woman. Foreigner here, so I'm sorry. I'm Lebanese and I've been here for 19 years and I still make such mistakes. So I'm terribly sorry. Go back to the questions. So, there's something I didn't really get. So when we buy the vegetables and bring them home or other things, that's not packed. Do we wash them or wipe them before we get them into the house?
I think most people would. I mean, I wouldn't say that you need to wash all the vegetables at the front door before you bring them into the house. But I think generally you'd wash the vegetable anyway, wouldn't you, before you eat? So I think generally the public health bodies haven't given any extra guidance on how to be cleansing food. So we just
Bro, are we washing it with soap or what?
No soap.
All right.
So we've got a question from Tani Kotubi. She said, does it make sense to wash all skin that was exposed outside once you are back home? For example, arms, face, feet, etc.
I guess the feet would not apply to a man, washing the feet, because your feet would be covered. I guess.
Well, you would hope so.
Yeah, I mean, it's not a bad idea to wash. Obviously, you would wash your hands. It's not a bad idea to wash parts of your body that have been exposed whilst you've been outdoors in contact with other people.
Okay. We have, this is the questions that we had so far. And what, as the last words of advice? We've already been about almost an hour on air, by the way, but time flies.
Yeah, my last bit of advice.
Before we do that, sorry, do you mind if I just put in 1 second? Before we do that, brothers and sisters who are listening, we have our beloved brother, a local lad, Geordie lad, Dr. Sharjeel, who's come on the show, and as a doctor who's working hard, mashallah, tabarakallah, on the front line with dealing with all the issues that we have right now. I'd like everyone to, as you're listening, as you're watching right now, you see that like button or that love button? Share some love for our brother and all of the people who are working hard within the NHS, on the front line, dealing with all these issues today. So please share your love and share your likes to these individuals, like our brother Dr. Sharjeel. Bro, you've had a lot of love. May Allah reward you. May Allah bless you. A lot of love from people who are listening. They're really asking. They're really praying for you. May Allah reward you. Stay safe as well. I did want to ask a question, if that's all right. The question I wanted to ask is, being a Muslim, and dealing with this? How's your religion, how's your deen helping you cope?
It's a brilliant question, and it would have been so sad to have missed this in the show. So I'm glad you asked it. The religion, the deen of Allah is giving me a lot of hope, because what I tell people is the qadr is written. Yeah. So if you were meant to have died from this, you were meant to have died from this. From the day you were born, this was how you would die. Yeah. This is what we believe as Muslims. Am I right?
Yeah.
Yeah.
So from that perspective, there's nothing you can do about it. However, likewise, we are told to tie our camels. You know, what is meant by that is to do sensible things. Listen to authorities. Listen to the scientists. Listen to your scholars. You have scholars telling you not to turn up for Jummah, not to turn up to the masjid because the threat is real. Listen to them. Don't come up with comments like, oh, these guys are sellouts and these guys just listen to whatever the government tells them. It's really stupid. It's foolish. And actually, people who are of that sort of mentality, you may have blood in your hands, to be honest, when it's all said and done. You may have blood in your hands, you know, because, and also conspiracy theorists, you know, they really need to be quiet, to put it in the most polite way, you know.
Mm.
This is not the normal flu. There's nothing to do with 5G. You know, I'm not sure what mobile phone network caused the plague during the time of Sahaba. I'm not sure what mobile phone network caused the plague then. So anyways, back to the question, Islam. Yeah, and also we know that people who die from the plague, you know, inshallah ta'ala, will be granted the martyrdom. And as we know, also there is a lot of key workers. So as a key, what you know, it's a noble thing to be working, helping someone, and that way, well, if that's the cause.
Allahumma ameen. I mean, it's a plague. And
from a religious point of view, I'm trying to see the benefits of this, and because there's so much hikmah in anything that happens, you know, and I'm sure, like you guys, you know, I'm really starting to miss like the things that, you know, the heartbreaking things that I'm missing. Not being able to see my parents physically, you know, not being able to see these loved ones. You know, we took all these things for granted. Not being able to, you know, go out with your kids, you know, and now, you know, it's almost as though like Allah is giving us a chance to really reconnect with the deen, you know. So I'm trying to make the most of it, and I think ultimately this experience, we're not going to be the same individuals. Either your iman's going to strengthen or weaken, and you know, you need to do whatever you can do to make this a good thing for you.
MashaAllah, tabarakallah, jazakallah khair.
One last thing. So you know when I'm coughing, right, or sneezing, am I supposed to do this? Yeah.
If that's the only thing you can do, and there's no tissues, and there's nothing else you can sneeze into, then I guess that's better than coughing into the person next to you.
Well, that's getting dirty now, bro. Now I've got to wash this top, right?
Go and wash it then, bro.
Okay, fair enough. Nice.
Jazakallah khair, akhi. Thank you so much for a very informative session. You've helped so many people, and inshallah it will be in your rewards deed, inshallah, forever. Jazakallah khair. There's nothing I can say after what you've just said. And anyway, you have to hurry for the Iqamah because it's about time now to do the Maghrib. Jazakallah khair. Thank you so much for tuning in. And please, guys, at 8 o'clock, there will be another clap, another opportunity to clap and support the NHS staff, members, all of them. And please like and share and comment always. Tune in with Fast FM. Jazakumullah khair. Assalamu alaikum wa rahmatullahi wa barakatuh.
Allah bless you, bro.